As a working individual with health insurance that has ever-climbing costs, the idea of having to pay higher taxes to provide insurance coverage for everyone else, even those choosing not to work, was frustrating. But when I stopped to think about this from a healthcare perspective and my 10 years of experience as a nurse in both the hospital and outpatient settings, it became clear that the Affordable Care Act was vital to the overall health of our nation for several reasons. First and foremost is that there truly is a tremendous need for health care in our country. Prior to the enactment of this legislation, just over 20% of all Americans were uninsured. The New York Times reported that since 2010, 16.4 million, or 25% of these folks, have been able to gain coverage. Another reason is the protection the Act provides for those with disabilities. Some individuals truly aren't able to work and support themselves and their families. The Affordable Care Act provides the health care coverage these individuals are in dire need of. I always think of my wife's grandmother, who worked so hard until her arthritis simply wouldn't allow her to work any longer. Without coverage from Medicaid, she couldn't have been able to afford her medications or receive the treatment she needed. Lastly, the legislation promotes preventative care, including those that are some of the most vulnerable in women and children. According to the U.S. Department of Health and Human Services, there are over 22 services covered at no cost for women, including those who are pregnant, as well as 26 for children. According to the Center for Disease Control and Prevention and many research articles, preventative care improves quality and quantity of life, assists in identifying health concerns sooner, and helps to decrease healthcare costs.